I'm Dr. Nucci of the Nucci Spine Orthopedic Institute, and I want to tell you about a new technique for the low back, for lumbar disc herniations, low back disc herniations. Traditionally, when a patient has a disc herniation that requires surgery in the low back, an incision needs to be made, a cut in the back, and the disc material is found and removed. This causes a great deal of pain and disability and blood loss, and there are newer techniques that can be used to make this surgery go more quickly, more effectively, and to return patients to function faster. What we do now at the Nucci Spine Orthopedic Institute for the appropriate patients is an endoscopic discectomy. And what that is a tiny incision is made and a small scope, like a scope one would use for sports medicine surgery and arthroscopy, is put down where the disc herniation is. Disc herniation is visualized and removed with small instruments and the disc repaired. This is a model of the lumbar spine, and it shows a disc herniation. This is the bones of the back, the vertebral bodies, and this is a disc. This model shows a disc herniation, this red material hitting the nerve, and the nerve comes out of the back and goes into the leg, giving you both back and leg pain. An endoscopic procedure means you would make a small incision in the skin and then take a camera and put it down to where the disc herniation is. This is the camera, or part of the camera, that would go through the skin down to where the disc herniation is. The disc herniation would be visualized directly. Then the camera is removed and a small probe is put down through that same incision under the X-ray guidance and to the area of the disc herniation, and the disc herniation visually removed. The camera is replaced to make sure that all the disc herniation material has been removed and there is no more pressure on the nerve. Additionally, at Nucci Spine Orthopedic Institute, we do disc repair. In the past, patients have always asked me, well, you've now removed this disc, what can you do to repair the disc? And we repair the disc with the probe itself, helps seal that disc injury, but we actually add growth factors down to the area of the disc herniation. Growth factors are natural healing chemicals in the body that allow an injury to heal. So if you had an injury to your arm or a cut or an injury to your leg, growth factors help that area to heal. What we do now before surgery is concentrate a patient's own growth factors down by drawing their blood, a small amount of blood, and those growth factors are concentrated and put down to the area of the disc injury. So in this case, once the scope is removed, the disc is repaired, the scope is put back again to make sure all the pieces are gone, the growth factors are injected through the same tube down in the area of the disc herniation and around the nerves themselves. Surgery would take usually 30 to 45 minutes, and patients will go home the same day and back to work in either a few days or a couple of weeks.